Hello, I'm Dr. Lakshmi and welcome back to Yashoda Hospitals online segment, the Health Talk session. Breastfeeding a child is important and undoubtedly beneficial for both the mother and child's health. It can bring such joy, but it can also come with its fair share of questions and uncertainty, and no mom should ever feel embarrassed to get those questions right. As the coming week is World Breastfeeding Week, joining us today, we have Dr. Bhagya Lakshmi, consultant gynecologist and obstetrician from Yashoda Hospitals, Secunderabad. Welcome, ma'am.
Thank you.
So, doctor, we know that breastfeeding is beneficial for both the mother and the child. So, could you quickly brief us what exactly are the benefits of breastfeeding?
Yeah, breastfeeding is something very natural which has been existing from the time man and animals have come onto this earth. So breastfeeding is one of the most important bonding, beginning of a bonding between the mother and the baby. Now it has benefits both for the mother and for the baby. Now first we'll talk about the benefits for the baby. For the baby, it is the best nutrition that it can get, the baby can get, and it helps in the growth of the baby, natural weight gain. It helps in the baby's brain growth. The milk that is produced by the mother contains almost 67 calories per 100 ml of milk, and it has adequate proteins. It has polysaccharides, it has lactose, which is very good, and it also contains oligosaccharides, which is a prebiotic. So the breast milk is very good for brain growth, for adequate weight gain. It is good for gut. It prevents gut infections. It is the most sterile. It does not require any preparation, and it satiates the baby very well. The breast milk also contains a lot of immunoglobulins and antibiotics. So this protects the baby from immediate infections even before the baby is vaccinated. Now this is as far as the baby is concerned. There are other benefits, like it even prevents neonatal deaths. We hear about sudden infant death. We hear about respiratory infections causing death. So all this is also reduced when the mother feeds a baby with the breast milk, and it also protects the baby as it grows older. It also prevents, or it decreases the chances of type 2 diabetes, decreases the chances of getting hypertension, cardiac disease, obesity. All these also are decreased over a period of time. So these are the long term benefits of a child having breastfed during its infancy. As far as the mother is concerned, it protects the mother from, basically first thing is it brings a bonding between the mother and the child, and then it helps the mother to lose weight. It helps the uterus to involute. It prevents excessive bleeding. Due to secondary PPH can be avoided. It also gives a long-term benefit of protecting the woman from breast cancer, ovarian and endometrial cancers. So these are all the obtained benefits of breastfeeding, and in the end it also gives financial security to the family, and also it decreases the burden to the nation also over formula feeds.
I think that's wonderful how a simple thing such as breastfeeding can prevent so many complications and benefit both the mother and the child's health. So, ma'am, pregnancy as such is a wonderful journey with mixed emotions. So, how do you think a mother, especially the first timers, should prepare themselves for breastfeeding?
The preparation for breastfeeding begins even before she delivers the baby. So that is why we here generally conduct antenatal classes and lactation classes, where we teach the mother as to how to latch the baby, how to prepare her breast for the baby, check the breast for any inverted nipples or retracted nipples or flat nipples, help them from the second trimester itself to, if there are cracked nipples or if the skin is very rough, give them some soothing agents so it becomes soft and supple, and train them that, and also explain to them how to feed the baby. So this is one very important factor. So it starts from the second trimester of pregnancy. And after the baby is born, a proper latching has to be taught, how to hold the baby, how to put the baby's mouth into the breast. All these things have to be trained so that the mother is able to go through this process without any stress and strain.
So, ma'am, talking about latching and positions, I'm sure most of the mothers are confused about this. So, what is the easiest technique that a mother can follow?
So the best way is to hold the baby upright. So for example, the baby's head should be on the elbow of the mother and the buttock should be on the palm of the mother. So she holds the baby totally in one hand. The baby is in skin contact with the mother, and the chin of the baby should be pressing against the breast. The mouth of the baby should be wide open, and the entire area should be going to the baby's mouth, and the mother should not have any pain when the baby is sucking. These are the most important things that has to be held. So this is the cradle technique. Some people also hold the baby's head and put the baby on the reverse cradle technique also, or sometimes when somebody is having twins, you can even have the football technique where the mother holds both the babies together. And in this what is the advantage of a football technique is the mother need not keep feeding all the time, so she has enough interval between feeds, so both the babies feed at the same time, sleep at the same time, so it is some respite for the mother. And if one baby is not able to suckle as well as the other baby because of suckling of the baby or the healthy baby, the second baby automatically gets adequate milk and nutrition. So this is a football technique which can also be adapted. Sometimes when the woman is not able to sit, left leg in the lying down position also, side lying down position also, she can feed the baby.
So ma'am, one of the most common question on every mother's mind is, am I producing enough milk for the baby? So how would one know that?
Yeah. So this is a very important question, Lakshmi. Many women always feel, many mothers always feel that they are not feeding the baby enough, though they may be actually giving good enough amount of milk. So one thing is, before feeding, if the mother has that feeling of fullness, that shows that she is having adequate milk. And when she is feeding from one side, there will be a let down from the other side. Automatically the milk lets down, so she feels that wetness on the opposite side. So this also says that she is having adequate milk. And the third thing is, when you see from the baby's side, initially as soon as the baby is born, for the first 1 week the baby loses weight. Then after that the baby starts gaining weight at the rate of 30 grams per day. So if the baby is gaining adequate weight and there is no further loss of weight, that is also a good sign. And the baby passes adequate amount of urine, say 6 to 7 times adequate amount of urine, adequate motion, and the baby is calm, peaceful, and it is a satiated baby. So these are all the things that tell us that yes, the adequate milk production is happening. And this should actually help the mother to feel happy, and she should feel confident enough.
So doctor, this brings up another important topic, that is painful and sore breasts. So how do you think mothers can deal with this at home?
Yeah, this painful and sore breast, that's why, as I told you previously, the woman has to prepare herself from the second trimester. So the gynecologist or the obstetrician, or if she is going to a lactation physician or somebody, so they examine the breast, they see if the breast nipples are inverted, and then they help them to use techniques to rectify this inverted nipple or flat nipples. And then we also give them some soothing agents even before, from 34-36 weeks, so that the areola and nipple becomes soft and supple. Then the third thing is, the latching is the most important. If the baby is latching only onto the nipple and not to the areola, then that means it's going to cause very painful and sore nipples, cracks. So the latching technique, as I told you, the 5 things that has to be followed is, the chin should be pressing against the breast, the baby's mouth should be wide open, and the entire areola has to go into the mouth of the baby, and the mother should not experience any pain when she is feeding. So if she is following all this, then definitely it will not cause so much of soreness or cracked nipples. But in spite of all this, if she is having some sore nipple or cracked nipples, the hind milk itself or coconut oil can be applied to the sore area. If it is not helping further, she can use a nipple shield for some period of time, so that the baby is not directly biting onto the nipple, and so that the healing takes place. But of course, sometimes it's very bad, it gets infected, there is a thrush, and then we might have to give antibiotics or antifungals to help them to come out of this problem.
So ma'am, talking about the most common questions on every mother's mind, another question is, does the size of the breast affect the breastfeeding?
Yeah, that is a myth. So the breast is made up of glands, fibrous tissue and fat, and of course covered by skin, areola and nipple. So the milk is produced with the glands. So the size of the breast depends upon more on the fat and the connective tissue, and it runs in the family. So the fat and connective tissue have no role to play with production of milk. So it all depends on the glands. So effectively the size of the breast definitely does not have any say in the amount of milk that is going to be produced. It is only the glandular tissue that is more important.
So ma'am, but some of them these days undergo breast implant surgeries. So do you think that affects breastfeeding? Has that got anything to do with this?
So again, breast implants are silicone implants, and they do not interfere with the glandular tissue, and hence they can, a woman who have got some augmentation surgery done can still go ahead and feed the baby without feeling the guilt that, oh, I've undergone a surgery, will I be able to feed a baby or not? So that guilt need not be there, and they can go ahead and feed their babies.
So doctor, how about working mothers when they are away from home and baby? So any tips or suggestions for them as far as breastfeeding is concerned?
So fortunately now, unlike the olden days, the government and all the establishments are giving them adequate maternity leave. That is one blessing in disguise. So at least for 6 months a woman is able to exclusively breastfeed her baby. Now before she decides that she is going back to work, so she has to prepare herself, her baby and the family who is going to support. It's a teamwork. So everybody has to get prepared and tuned so that there is no pain for the baby, or the baby is not starved. So 2 weeks before itself, the woman starts to learn to express the breast milk and store the breast milk, and starts to feed the baby more frequently so that she produces more milk. And once she starts going to work, and before she goes itself, she should be able to do a spoon feed or a paladi feed for the baby a couple of times. At least 2 or 3 feeds should be made and converted into a paladi feed or a spoon feed, so the baby does not become cranky and it starts to accept the feeds, and it's a smooth and transition from exclusive breastfeeding to a spoon feed or a paladi feed. And the family also gets adjusted, so the supporting system is able to manage this issue very well. Now once she goes to work, she feeds the baby in the morning, and just before going to work she feeds the baby, and if there was any extra milk throughout the day, she has to collect it in a bottle. Now the milk can be stored in a bottle up to 6 to 8 hours at room temperature, but if she has got more milk, it can be refrigerated up to 24 hours. So whatever extra milk she produces, she has to keep storing, and she has to refrigerate it, not in the door but inside the fridge. And when the baby is hungry, then this milk is thawed in warm water, brought to room temperature, and then the attendant, whoever is handling the baby, will feed the baby with a spoon or a cup or a paladi, depending upon the age of the baby and the convenience for the baby and the system and the team that is handling. And once she comes back from work, she cleans her up, and then again she starts feeding the baby and continues to feed through the night as and when it is a demand feed. So this way it becomes easy for her, and at the office also she can keep, if the breast milk is more, if she is feeling some engorgement or some the pressure, or she feels a letdown, then she can go to the washroom, or I think all the institutes should provide a place for these feeding mothers, a clean area where they can express and store the milk. And if there is a creche, nothing like it, she can take the baby to the creche, and in between she can go and feed the baby as and when it is required. So this would help her to continue to feed the baby for at least 2 years, and it gives all the benefits both to the mother and the baby. At the same time, she continues to go to work.
So I think not just the family support, but also support at workplace is equally important in promoting breastfeeding awareness. So ma'am, before ending this episode, what message you would like to give, as the coming week is World Breastfeeding Week, to all the mothers out there, especially the first timers?
So first timers, now unfortunately or fortunately, our system has changed from a joint family to a nuclear family, where it is only the husband and wife who is managing the whole thing. So when we started our practice, it was used to be the mother-in-law, or somebody used to come accompany. But it is nowadays, it's just the husband and wife who come most often, and both of them are working, and it becomes very difficult. So they come with a questionnaire, and that's a good thing. You come with a questionnaire, you ask all your questions. Don't go home with lots of doubts in your head. Ask whatever is in your mind, or if you keep forgetting your doubts, you jot it down, come talk to your consultant properly, you clear all your doubts, attend antenatal classes, learn the right breathing techniques, learn the right exercises, go for lactation classes, and then learn how to feed your baby. Utilize the help that is given and don't get anxious. So I know it is a transition from a single woman to, or one person to an additional new baby whose we do not understand their mind. The baby also is new to this world, experiencing all new things. So the baby can get cranky, the mother can get cranky. She's deprived of sleep, she can't eat on time, but this is all part of growing, and you got to accept these, and the family has to be supportive, the husband has to be supportive, and you make use of the help around you and try to have a comfortable pregnancy and a happy parenting. That's all that I would like to say. But don't stop breastfeeding just because it's becoming a stress. Bottle feed is even more stressful, that is even more unhygienic, that can cause more health harms to the baby. So as far as possible, try your best to feed your baby with your own breast milk at least for 6 months without adding any additional formula feeds.
I think I second that, and I couldn't agree more that breastfeeding is much easier than bottle feeding, and it brings so much joy both to the mother and the baby as well. So thank you, ma'am. It was wonderful having on this talk today.
Thank you, Lakshmi. Thank you.
So this brings us to the end of this episode. Hope you all enjoyed watching this episode on breastfeeding and all your queries are cleared now. And do join us for the next week as well. Thank you and stay safe.